Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Today on the show, we have Enna Hussein. She's an otolaryngologist and she co-wrote the KevinMD article, Physicians' Role in Bridging the COVID-19 Health Recommendations Divide. Enna, welcome to the show.
Hi, thank you, Kevin. Happy to be here.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Sure. So I'm a board certified otolaryngologist who subspecialized in laryngology. So that means that I manage disorders related to the upper aerodigestive tract, such as difficulty swallowing, difficulty breathing, and voice issues. I am currently section head of laryngology at an academic institution in Chicago. So that's my work life. The other part of my life, my home life, I am a daughter of an otolaryngologist, so second generation female otolaryngologist. I'm married to a husband who's in medicine as well, and then we have 3 small daughters. So currently that takes up a lot of my time as well.
Wonderful. And how has the pandemic affected both your practice and your life?
In terms of being an otolaryngologist, I mean, otolaryngologists are at high risk for contracting COVID due to our work in the upper aerodigestive tract. So as soon as the pandemic hit, it essentially put our clinic and our operations kind of at a standstill just because of the high risk of contracting COVID. We are pretty much open now, but we see patients with a lot of precautions. So kind of full N95 mask, face shield, I wear scrubs to work now. So it's really changed the way we interact with our patients, but we're still able to provide those services that we were before. In terms of work life, so along with a lot of other parents in this country kind of struggling with figuring out distance learning versus in school, what's the best decision for my family, and kind of how to navigate some of those challenges.
I have a daughter who's a sophomore in high school and another in grade 6, so I'm right there with you with all those challenges versus distance versus remote learning. So let's talk
Right.
about your Kevin MD article, Physicians' Role in Bridging the COVID-19 Health Recommendations Divide. So for those who haven't read your article that you co-wrote, can you share a little bit about it and walk my audience through it?
Sure. So I actually co-wrote this article with a colleague and friend, Dr. Jill Jeffy. She's actually a pediatric otolaryngologist. And what's interesting is this article kind of came from our lunchtime discussion. So we would talk about kind of what we were feeling in our work life and our home life, and kind of this the idea for this topic and paper came from that. So basically what it's about, it's this idea that as physicians, when we're at work, we're constantly bombarded with COVID, right? So precautions, how to see patients safely, how to keep everyone healthy. But yet when we leave the hospital setting and we would go grocery shopping or go to Target, we didn't feel that same sense of urgency and the need for the precautions that we felt at our work life. So we felt that there was this huge disconnect between the message and the narrative that was out there regarding kind of how to protect yourself from COVID. This came about during summertime where it was right after 4th of July. There was lots of, parties and parents and family wanting to gather. And we just felt that we were the ones that were saying, we need to wear a mask, or no, we still need to social distance.
Mm.
And so we wanted to write this article as a way to kind of guide physicians on, what role we can play in helping close that gap and kind of, our role in that. So that's where the kind of the background for this article came from.
Now, what are some specific areas of public health messaging that's getting misconstrued by the public?
Right. I think one of the big ones that was very early on was kind of the need to wear a mask or not. So unfortunately, early on the recommendations were that we didn't need to wear a mask. That quickly kind of switched. And so I think what happened was with kind of national agencies kind of backtracking a little bit on their initial recommendations, it doesn't really bode a lot of confidence. And that's the perfect type of environment for people who are very opinionated, maybe the opposite way, to get a foothold. And so kind of a couple of things that, we still are really promoting is the mask wearing, the social distancing, the limitation of indoor gathering. As a laryngologist, I work with a lot with professional voice performers. And so one of the things we're still kind of honing in on them is indoor singing is not safe yet.
Mm.
And so, that's kind of some of the stuff that we're still kind of telling our patients out there, because even though it's summer and soon it'll be the holiday season, and a lot of choir groups, church groups, that sort of thing want to get together, it's not safe to do that yet.
So when
That
you're in the
happens
room
a
with a
lot.
patient who is skeptical, what are some of the techniques that you found to be successful?
I think the first thing is to not ignore it. So I think, as healthcare providers, we are very busy, right? There's always more to do in a day than the time, but you can't ignore it. So when someone makes a comment that's that they don't believe in COVID, that is a time to take that extra 30 seconds and actually stop, look them directly, and be like, that's not true. And I think as physicians, we need to understand that we do have a lot of power when we have those interactions with patients. It's not just our role to kind of teach them about vocal health or help them with their difficulty swallowing. As a physician, it's also my role and my duty to basically help them through public health challenges because that affects their overall health as well. And so I think the main thing is that physicians need to know that it is okay to stop a patient and tell them they're wrong. You have the expertise, you have the knowledge, you need to share that. And so I would really encourage physicians, one-on-one is the best way to try to get through to somebody in that intimate kind of in-office experience with the patient. So use that. Take 30 seconds and just kind of give them the other side of the argument.
Sure. Now, taking a step back, what can we do from a broader perspective? Because I think there's mixed messaging also from the federal government, of course. Now, is there anything that we physicians can do from a broader perspective to help with that accurate public health messaging?
Definitely. I definitely think there's ways that we as physicians can kind of combat some of that. I'm sure you're aware the most recent kind of firestorm that came out was, our CDC kind of made comments about only 6% of
Hmm.
over 180,000 deaths were maybe actually due to COVID. That's not true. And a lot of physicians, especially on social media, have taken to kind of explain what that really means in terms of how you create a death certificate and the different
Hmm.
diagnosis codes that you need to place. So I think the main role that physicians actively can take right now is be vocal, get on social media and share your stories. Get on social media and explain, educate the public. Patients and the general public do not know the intricacies of, for example, writing a death certificate or how a diagnosis is made. So let your voice be heard. I really encourage physicians, especially, to be active on things like social media. I recently started doing this during the pandemic, and I found such an amazing community. And I found that a lot of people are getting their information online now. And so we need to have, a footprint online as well in order to kind of essentially compete against some of these, there was that pandemic video on YouTube, and we need to compete with it. We can't just stay silent in our offices and assume that the word is getting out.
Now, for those physicians who may be a little bit hesitant on going to social media, what exactly do you mean by sharing their stories on social media, and how exactly can they do that?
Twitter is a great forum for dissemination of medical knowledge and medical information. So the hashtag is MedTwitter, and it's actually really popular. So one way to do it is when new studies come out in reputable journals, share those, retweet them. Commentary is not even necessary. Just retweet it so that it gets spread out and people have an access to it. And it's a reputable source, so you're sharing that information. That's probably the simplest, easiest way to disseminate information. If you think of how many people actually read these medical journal articles versus how many of them actually probably now see them on social media, I mean, the numbers are astounding. So that's one really easy way. You don't have to share personal. People often get worried, like, I don't want people to know about my children and stuff if I'm on social media. That's fine. Just keep it completely professional. Just retweet articles, and it's even that alone is enough.
Now, I talked to a lot of physicians who are on social media, of course, and they're concerned about the pushback they get. The more controversial the topic is perceived to be, the more pushback they're going to get. What kind of advice do you give to physicians who may be facing patient pushback from what they're posting online?
I would say that if you're true to yourself, you're not doing anything wrong, right? So it takes, you have to figure out what's best for you and your family and your personality and that sort of thing. But that's almost a form of bullying, right? So let me just bully this person into not
Mhm.
saying what they know to be true. And not everyone is able to stand up to that. And I don't think, it should be the expectation that you can stand up to that kind of bullying. But I think, that that's exactly what it is. It's just bullying. So use your education, your years of training, your review of medical literature. It's okay to share that, because for as many people as don't want to hear that, don't want to listen to that, there's people that are being helped. And really, at the end of the day, even if one person is saved, saved, that's worth something. So I would say it's a definitely a personal decision in terms of how, how controversial of a topic that you want to delve into. And a lot of this comes with years of kind of experience and training. So it's a lot easier to do this once you're established in your practice and your career. And if that is the case, then maybe help mentor those who are maybe entering the field, because confidence doesn't come automatic with the MD, right? It takes
Mhm.
kind of years of establishing yourself. And so it's a personal decision, but I think there's ways that we can all be involved.
Sure. We're talking to Anna Hussein. She's an otolaryngologist, and she co-wrote the KevinMD article, Physicians' Role in Bridging the COVID-19 Health Recommendations Divide. Anna, what's something that you know now that you wish you knew back before the pandemic started?
I think one of the positive things that came out of the pandemic for me was really just finding a sense of community, especially amongst other healthcare workers. I think often we just get trapped into this kind of silo of our individual practices or day to day. And what the pandemic allowed me to do was kind of look outside my individual circle. I've made lots of colleagues in different departments who share kind of my same views on things like COVID precautions and kind of the future, with schooling and things like
Mhm.
that. And so I think one of the things I wish I knew was that there's a whole community out there of people who are very similar to you, and strength comes in numbers. And so to find colleagues who maybe aren't, right next door to you, or, in your even your same hospital. And that's one of the benefits, to be honest, of social media, is that it's connected with me with healthcare providers across the world. And so it makes a very strong kind of collaboration. And so I wish I just knew that earlier, not just had to wait for a pandemic to learn that.
And my final question, do you have a take-home message that you want to share with the KevinMD audience?
I would say speak up. You are educated, you know what you're talking about, your voice needs to be heard. And so if that is just telling, a mother-in-law about something or a neighbor about something, it's okay to speak up. And I think, as physicians, we should really be kind of proud of the information and the knowledge we have, and share that, with the public.
Well, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thanks, Kevin. Have a great day.